I'm gonna make you an offer that you can't refuse. I'm just kidding. Hello everyone, you're on the Semi-Medical channel, where I analyze medical topics with the clinical cases in an accessible language. Today, our bloody topic is dedicated to the coagulation cascade. The coagulation cascade is one of those topics that you learn, forget, and relearn countless times during your time in medical school. It's not uncommon to forget which factors are part of intrinsic and extrinsic pathways, which test is used to assess each one, or even way in the pathway different drugs act. I'll put this together in one place and show you some tricks to remember the particular bits. So, this is the skeleton of coagulation cascade. I will draw the intrinsic pathway in right. It results from contact activation with the surface damage and features factors 12, 11, 9, and 8. The extrinsic pathway is here in blue, and it results from trauma or inflammation that leads to tissue factor release. Remember also that tissue factor is also known as a factor 3. Tissue factor then activates factor 7 and form a complex together, and then combine and activates factor 10. As you can see, the factor 7 and tissue factor complex as well as a factor 8 both activate factor 10, and this is therefore will both pathways need and become a common pathway shown in purple. Activated factor 10 causes prothrombin to become active thrombin, known as factor 2, which then cleaves fibrinogen into fibrin, also known as a factor 1, and ultimately leads to clot formation. As a side note, factor 5 is cofactor when the other factors are enzymatically active, and activated factor 5 is needed alongside calcium in order for activated factor 10 to convert prothrombin into thrombin. The way I remember which factors are intrinsic pathway and which are extrinsic is by thinking how and when they do count to tens. For example, they count down in 3, 2, and 1. And this time we'll remember that countdown is in the intrinsic pathway 12, 11, 9, and 8. Another way is that extrinsic pathway contains factors 7 and 3, which is tissue factor, and so they sum up to 10, which is also written as an X. It's a bit of stretched, but helps me to remember them. As for the lab test, a PTT is activated thromboplastin time, also refers to as PTT, while PT is prothrombin time. The way to remember which test looks to which pathway is by remembering that you play table tennis inside while you play tennis outside. Remember, the PTT and PT tests also evaluate the common pathway too, so the factors 10, 5, 2, and 1. The PTT is normally from 25 to 29 seconds, where the PT is usually about 12 seconds, but these values change between labs. Another important thing to remember is vitamin K dependent factors, which are factors 2, 7, 9, and 10. So causes for prolonged PTT time with a normal PT included deficiency in a factor 8, for example in a hemophilia A or von Willebrand disease, a deficiency in a factor 9, seen in a hemophilia B, or deficiencies in a factor 11 or 12. In prolonged PT with a normal PTT can come from factor 7 deficiency and may also be a sign of incoming disseminated intravascular coagulation or an early sign of vitamin K antagonism. Since the factor 7 is a factor with the shortest half-life, this means that in an early stage the remaining vitamin K dependent factors, which are 2, 9, and 10, are not affected as much. If both PT and PTT are prolonged, then the causes include decreased vitamin K activity that more prevalent. So again, the vitamin K deficiency from lack of intake or excessive warfarin treatment, as well as this, moderate to severe disseminated intravascular coagulation or liver disease may also be causes. The treatment with a high doses of heparin or direct oral anticoagulant drugs can also cause a prolonged PT and PTT. Drugs used to prevent clotting act on different locations on this pathway. Heparin works by binding to antithrombin 3 and increasing the antithrombin reactivity, which works to inhibit activated factor 10 and the thrombin. Low molecular weight heparins like cyanoxaparin and dalteparin work in a similar way. But antithrombin 3 low molecular weight heparin complex has less or no activity against thrombin and will have more specific affinity for activated factor 10. Warfarin is vitamin K reductase inhibitor, and vitamin K reductase is needed to restore vitamin K back to its activated state. If this can't happen, then no activated vitamin K is available to form the vitamin K dependent factors, and so the less of these factors are synthesized. It takes time, however, for amount of the activated vitamin K decrease significantly and therefore for synthesis to stop. So this is why patients often given a heparin for a few days while waiting for warfarin to work. In effect, warfarin actually promotes clotting in the first few days because it also inhibits protein C and protein S, which are anticoagulant molecules involved in inhibiting factor V. The direct oral anticoagulants, DOACs, sometimes called NOACs, work by directly binding thrombin or activated factor 10. Rivaroxaban and apixaban are examples of direct activated factor 10 inhibitors, while agatroban and dabigatran are examples of direct thrombin inhibitors. You can see these differences in the name, with the rivaroxaban, for example, featuring factor 10A ban in the name. The effects of heparin can be reversed with the protein sulfate, a compound bind tightly to the heparin or low molecular weight heparin, form the compound with no anticoagulant properties. The antidote to the warfarin is vitamin K, but just the warfarin gets time to work, the antidote also takes a while, because new factors need to be synthesized. Fresh frozen plasma and a prothrombin complex concentrate may be given for immediate reversal, but you still need vitamin K to maintain it. Other case, the monoclonal antibody is given as antidote for dabigatran. Well, the andexanet alpha was recently improved as an antidote for direct factor 10 inhibitors. Alright guys, this was Coagulation Cascade and it is extremely high yield, you have to know it. Please subscribe to my channel and click on the notification button. You can also support me on a Patreon or PayPal using these details. Thanks for watching, learn medicine in easy and understandable ways. As I always say, make medicine easy.